The cornerstone of treatment in schizophrenia is the antipsychotic treatment. And antipsychotics have risks and benefits. The main benefit is that it controls the positive symptoms and prevent relapse. The risks are side effects. And side effects can impact negatively some of the factors that are related to functioning. And here we can intervene. Functioning is, first of all, multifactorial. There is a family functioning among family members. There is the functioning at work, if the patient is working or not, occupied or not, what kind of programs he is involved with, what about his social life, his part of well-being is also involved. We have to remember that many factors impact functioning. Some of the many factors that influence functioning we cannot intervene in, but some we can. For example, the side effects. There is a large subset of patients that experience a lot of side effects. These side effects can impact well-being, can impact mood, at the end of the day can impact their functioning. And a subset of patients are really sensitive to this domain. We should identify these patients as early as possible. We have to think about the dopamine hypothesis of schizophrenia, because on one hand, schizophrenia is a disorder of too much dopamine. When you come to think about the mesolimbic dopamine pathway, too much dopamine activity related to the positive symptoms, the psychotic symptoms. But on the other hand, schizophrenia is also a disorder of too little dopamine. Negative component, negative domain, cognitive domain are all related to too little dopamine activity. This is almost a paradox, because whatever we will do treatment-wise, we can make one domain better at the account of impact negatively the other domain. And the other domains, for example, the negative symptoms domain, the cognitive symptoms domain, are related to functioning, as well as the positive symptoms domain. So what do we do? Again, it's complicated, but what should we do is we have to handle dopamine, I would say, in a smart way. Because of this catch-22, if you may, the paradox of too much dopamine, at the same time there is too little dopamine, and normal activity of dopamine at the same time in the same brain of patients with schizophrenia. Our job is to tailor the right compound so we can deal with these side effects, control the side effects, and think all the time about the dopamine hypothesis of schizophrenia and how we can find the right combination, the sweet spot, in order to balance risks and benefits with our patients.